In this module, we'll be discussing humerus x-rays or upper arm x-rays. This will include the AP and lateral views. Now the AP humerus can be done either on the upright bucky or on the table bucky or even tabletop. But in most cases, you'll want your patient, if you have this availability, to do this on the upright bucky because of simplicity's sake as well as productivity purposes. So you'll have the patient with their back against the board. You've already centered your crosshairs to align with the cassette and the bucky, and now the patient's humerus is lined up. You're centering at the mid shaft of the humerus. The patient has her hand slightly abducted and supinated with her hand or palm facing toward the camera. We can see that with a virtual hand here. She may want to hyperflex it so you can see the humerus in good profile. We'll review this anatomy here in just a minute. A good benchmark technique or a baseline technique would be 10 mass at 60 kbp. This is designed for the upright bucky with use of a grid. For the anatomical evaluation, we can see the humerus, the shoulder joint, almost in its entirety here, and you also can see the elbow joint. We know now that we've gotten the entire shaft to include both ends, so this is a good positioning. To determine if you've got good rotation for the AP, you can see the greater tubercle here. I mean, it deviates from the rounded look of the humerus when you see these protuberances either on one side or the other. That indicates that you've got a good AP rotation. You see that there? That's the top part of the humeral head, but of course we have the protuberance that kind of extends out beyond that. We also can tell that we've got a good AP because you've got the epicondyles of the distal humerus, where if you grab the bottom part of your humerus, this is essentially your funny bone right here, and then you've got one on the other side. If you can feel those off in profile, then you've got a good AP. We've also included the joint here, so again, this is a good AP as an example. For the lateral humerus, this takes a little bit more effort on the patient's part. The patient doesn't have to have their hand on their hips. You can see where she's got her hand kind of flattened up against her hips. All other factors remain the same, with the exception of the patient's position. So you might have to lower or raise the camera and the upright bucky to accommodate this position, but essentially the patient has their hand flush against their hip to rotate their humerus inward, and this kind of flips that elbow joint in profile, and hence we've got a lateral view coming. You see that there. A good technique for this examination is the same as it would be for an AP humerus, 10 mass at 60 kbp. Here's a better look at it. You can see that now the joint space of the elbow is seen in complete profile. Those condyles are now overlapping one another, and they look like circles. You can also see the hinge joint as the radius wraps itself around that elbow portion. You can see it a little bit more clear here. Some people, if they don't get the elbow joint all the way, they'll go ahead and get a lateral of the elbow to include that. Make sure we get both portions. And of course you can see the shoulder joint. You can see the shoulder joint in profile up here. This is a unique view because somehow or another the patient has rotated themselves to where we see a side shot. It's called a Y view of that scapula. That's a beautiful view. But again, your goal is to make sure you get the entire humerus rotated in a lateral position to include a side shot of the elbow joint itself. And that concludes our review of the AP and lateral humerus views.